come the Big Rig Kids, y'all. Are you ready? Let's go. Here come the Big Rig Kids. Roll with the Big Rig Kids. Let's have fire the truck, take you to such amazing places with the Big Rig Kids. Those helpful Big Rig Kids.
Welcome to Conversations with Grandma Polly. I'm Kenneth J. And before we get started tonight, I just want to let you know we got a very wonderful, exciting guest for you tonight. But before we get into all of that, let's bring in the woman who is everybody's grandma, Grandma Polly, ladies and gentlemen. How about it?
Good evening and happy Thursday. Welcome to Conversations with Grandma Polly. This evening we're going to be having a conversation with Nurse Practitioner Towanna Lance. We're glad to have her on the show, and you guys welcome her because it's going to be a great conversation this evening on women's health. Tawana, you can introduce yourself, give us a little bit of information about.
Hey, um, my name is Tawanna. I am an adult primary care nurse practitioner, and I currently work in HIV specialty care. I still do quite a bit of primary care in that role as well.
Right.
Great, great, and welcome. We're glad to have you this evening.
Yes, we
Thank you
And
for
are.
like I,
having me.
Yes,
yeah,
we
we're
are.
glad you're here. And we're gonna dive right in. I'm gonna give a little view about what what is in my head and what I'm thinking, and you could add on to it and let us know what's going on. I remember when we were growing up, and when we talk about women and their health, me personally, when I was growing up, mama never worked. She never had to work. So when we got home from school, there was always a meal cooked. We had chores, all those things. But today we live in a different time. And the way things are today, I would like to ask you the connections between, the woman's place today versus what it was back then when we were with mom. Mom took care of the house, she took care of the children. Dad went out and worked, but today, we have single parents. We have two parent homes where both parents have to work, and we don't just live in our villages anymore. So, what are some of the what are some of the differences and some of the connections in some of the things you feel like Black women are faced with today and how it impacts their health?
So that's a really good place to start because you have to, for context, think about um, who Black women have been, are, and will be as it relates to our role in society at large. So if we go far back enough, like you talked about, even when I was growing up, when we were growing up, my mom, she was a housewife for most of my childhood. She didn't work outside of the home. She cooked, she cleaned, she took care of the kids, and my dad went to work and paid bills. But if you think even further back to about who we have been to everybody else, we've always been everybody's caretaker, right? And so,
Yes,
even back, we go. I don't want to go too far back, but I just want to give context to kind of
right,
help us walk to where we are now. You think back to the old slave plantations. Black women took care of everyone.
right,
She took care of the slave master when he wanted. She took care of Mrs. Kids when they wanted. And then when she was done with all that, she took care of her husband if she had one and her kids if she had them. And she worked the fields or in the big house. She was everything to everybody. And
right.
so historically, the role of Black women has been to be the caretaker of everybody around them. And so
Mm-hmm.
then what happens is um, we neglect ourselves because a lot of times we don't prioritize ourselves, and it's very simple things. You even get on Facebook, and just as something anecdotal about what we see, and I rarely see anybody but black men and women go back and forth about things like, these days, who should be paying half the bills? When a woman cooks, should her husband be fed before the kids? But there's never any discussion about who's going to fix the woman's plate. It's all very funny and lighthearted, or it's supposed to be. But all of those things are a reflection of reality and the black woman's place in her family, in the workplace, and just like out here at large. And so for me, I see those things spill over when my patients, even before I started working where I was prior to this, I was totally working in primary care. And even now, you know, black women have to choose, because sometimes we are the head of the household. And even when we aren't, we still are taking care of everybody else. So we have to think about what our husband needs, what our kids needs before we consider, I got a doctor's appointment today, but you know what else? I need to get the kids off of the bus. Or
Or
my
even
husband
you
has
don't
something.
schedule that doctor's appointment because everybody else's schedule is on your plate.
Right, and that it's different. We live in a different age with technology and all this stuff, so the things we tackle are different, but the themes are the same. We taking care
Right?
of everybody else before we even think to take care of ourselves, and lots of things go lacking. um
You're right.
yeah.
That
And it's
that
funny because I've had this conversation with my husband several times when I look at the things that are happening in society today. And I say to him, I'm like, even when we were growing up, and like you said, it comes from slavery on up to now, when a woman have a baby, the first thing you hand that baby once they're able to grasp onto things is something that looks like a doll baby. The girl wants to mimic that mom. So we're teaching them how to nurture, how to care. But then who is teaching the men to be men? That's where it is in society. And we get to that point, like you said, I agree with you 100%. We neglect ourselves in so many different ways that eventually it takes a toll on us after a while.
And the thing we also struggle with too is there's so many things other than just the dynamics in family and just interpersonal between people that impacts that. Because if you want to talk about, because lots of people like numbers, and they like numbers to back up what you're saying.
Right.
But if you think about the numbers, black women more often are the head unmarried and the head of their household. Black women more often are raising children on a single income. Black women more often are earning much less than anybody else out here in the workforce. The crazy thing about that, because it even spills over into how we get taken care of when we do go to our healthcare providers to try to get the care we need. So working in the HIV clinic, I see lots of things. I'm responsible for not just taking care of patients who are living with HIV, but also responsible for taking care of their primary and preventive care health needs. So I'm doing
Mhm.
ordering mammograms and colonoscopies and pap smears, and I'm doing all these things. And the conversations I have with my patients when, I got a 50-year-old woman who's got three grown children, and she says to me, I haven't had a pap smear or a mammogram in 15 years.
Mhm.
It sounds almost crazy to me, but then I also have to understand that when you don't necessarily know better, you can't do better. And also, when you don't have access to resources or somebody educating you about why these things are necessary, you don't know to seek these things out. So that's why I think for me, I will admit that I do carry a little bit of bias as far as the importance of what I do as a nurse practitioner. I take care of
Mhm.
everybody. I don't care what color you are. I don't care what religion you are, how old you are. If you come to me, you're going to get the best care I can provide. But it's a different tone and texture for me when I see patients who look like me, kind of come from the same places that I come from.
Mhm.
It hits a little bit different. And then when you start talking about the numbers, um, Black women account for 60, between 55 and 60% of all the new HIV diagnoses in the United States, even though we make up only 7% of the population here. We die
Mhm.
more often from breast cancer. We die 4 times at a rate 4 times as high in childbirth as any other group of women in the United States. And why is that? It's not only because of the way we don't take care of ourselves, but it's also because of the way nobody else is really taking care of us. So it means a little more to me, and I hope that's not bad to say, to
It's
educate and
not.
put the work in for my patients in general, but for my Black female patients, it does. There's a different level to it than just the average patient that I see from one day to the next.
I understand that, but do you get? I'm a person who don't like taking medication, and I've been blessed so far where I haven't had to have any type of medications that's long term, as far as diabetes, high blood pressure, different stuff like that. But when you're educating our people, do you get do you ever get any type of resistance from them?
All the time, every day. Like, it's an ongoing process for a lot of my patients, because of course there is a deep mistrust of the medical community, and just from past history. All we got to do, we talk about the Tuskegee experiment and the Henrietta Lacks gene line, and all of this stuff. You Even with the COVID vaccine right now, right?
Right.
Like, it has been nearly impossible to get enough of my patients, where I feel enough of them have been vaccinated. And I have patients, I've been at my current place almost 5 years. And I have patients who I've been seeing from day one, that every time they come and see me, I have to have this really deep conversation with them about why it's important for them to continue to take their medicine, because it's a question in their head every day. Number one, do I really have HIV? Is this a real thing, or is this something the government's using to control my mind? You wouldn't
Mhm.
believe how often I hear things like that. And then the medication
Mhm.
is just another way to poison them or give them disease. And it's difficult for me to it's not difficult for me to push back. What's difficult for me is to both feel and understand where they're coming from, and be able to have empathy for them, but also know how important it is for me to stay in my role as a provider that's trying to help take care of them and keep them healthy. And that's the thing, it's a duality for me. Like, listening to my particularly my Black patients talk about how they don't trust the medication, they don't trust the medical community. I never discount any of that. I never say, oh, you crazy, you don't know what you're talking about, look, read this in this book, because it doesn't mean anything to them. And I get that, because of where I come from, right?
Right.
And growing up around my grandparents and even my parents, sometimes, we have to do a little bit. The COVID vaccine, it took us months to convince my dad to get it. Months.
Mhm.
And it's not an isolated thing, but I think the big deal has been for me to just not use big words and tell them what I read and what I got out of a book, but just to develop trust with them and let them know that I honor what they're saying, how they feel, and how they think, and that I get it. I agree. Let's you and I figure out how we can make you comfortable with this process going forward. But we see it all the time.
I like
Yeah.
how you
And
put that. I really
I
do.
mean, yeah, and that was great. And I think listening to you, and I know there's a lot of distrust when it comes down to the medical field, but there is a lot of distrust when it comes down to race also. There's a lot of distrust there when it comes down to race. There are certain doctors that I know that I will never go to see unless it's just an emergency situation and that particular doctor is there, because I have a certain feeling about things like that. All of my doctors from the time I became an adult has always been someone who look almost like us. Even if they don't look like me, they got to be, I don't know whether it's a prejudice or what, but they have to be a brown skinned person, because for me, I always felt that during the time when we was growing up, we had the two doctors in Georgetown, which there were other doctors, but the two main doctors that we used to go back and forth between was Dr. Assey and Dr. Beck. Dr. Beck was the black doctor and Dr. Assey was Jewish. But I feel that the treatment that Dr. Assey gave, maybe it was okay, but it stuck in my mind having to walk into this doctor's office and there is a wall with two doors where black people walk in on one side and white people walk on the other. And that's just something that stuck in my head up until this day. And it built a distrust there.
Hmm.
So a lot of it, I think, the medical field, yes, but then some of it has to do with race also.
Because I mean that's where it started. The reason why we were treated differently, or as patients, as people, was because of the color of our skin. So those
Hmm.
fears get passed down generationally, and it's always crazy to me. As much time as I spend sometimes on these social media sites and just listening to the news and stuff, how people will say, "Oh, but that's in the past. You know, this there's no racism." That's listen. I'm
That's a lot
44
of
years
well.
old. I was born in 1977, and I remember walking through those separated, using the black entrance at Dr. Assey's office. I
Yeah,
also remember being 6 or 7 years old and watching the Klan march down Front Street like it was
right,
the Christmas parade. So these are not things that are so remote and so far gone that I don't think anybody should be able to understand the fear and the mistrust that black people have in general. The problem becomes though is that I'm gonna say something. hmm, I do believe there is a place for segregation in some things in some ways, right?
okay,
We talk about, and not like, black and white people or any other people shouldn't mix. But when I say segregation, I mean, I do think that black people fare better when they are educated by people or taken care of by people who have shared and similar experiences. So
right,
I was reading something the other day. Um, a interview Stephen A. Smith did, y'all, from ESPN, and he was going
hmm,
on and on about what LeBron and them should do because there's only 7 black head coaches in the NBA. The thing about that is statistically, and I get it, he's a sports guy. Statistically, that 7 out of 30 black coaches far outshines what we see in the general population. So we could complain about it. But do y'all know that of all the doctors in the United States, only 5% of them identify as black?
Wow.
And so the likelihood that we're going to go in spaces where there's people who look like us that are going to take care of us, that is not, that's not a likelihood for us. And there
Right.
are obvious and documented differences in the physiology and the biological makeup of Black people and white people and Hispanic people. So certain things work better for us and certain things don't work for us. The crazy thing about that part is the treatments that we get are what's left over from what they did to treat the white folks, right? And I'm trying to be as politically correct as I can, but just, I mean, especially working in the HIV clinic. Um, when this thing first went boom back in like the late 70s and 80s, it was the disease of a gay white man, right?
Right.
When they were developing all these medicines to save lives and all of that stuff, that's who they were working for. Then all of a sudden you had a shift, probably late 80s, early 90s, where now the large majority, over 50% of all the new diagnoses total are among Black people and lots of young Black men as I see it walking into the clinic. So those research trials weren't done on Black folks. Even the newer medication that they're developing, there is not a large enough representation of people who look like us in those research trials for them to say this drug is good for you. We're getting what they're giving us based on what they've developed that works for other groups of folks.
People.
And
Hmm.
I don't know how to change that. And I don't know how to dispel the mistrust because I see those things. That really is part of the reality of what Black folks deal with when they maneuver through the medical system. I mean, it just is what it is. And sometimes I feel bad saying these things, but
It is
even
what
in the
it is.
places where we fare better, like as far as Black women are out are educating themselves and earning degrees at a pace that I mean is leaving everybody else in the dust right now. But when
And
you look
that's
at
their biggest fear.
the outcomes still, Black women are 4 times as likely as anybody else to die in childbirth, right? And it
Hmm.
doesn't
I
matter
heard that.
how much money you have. It doesn't matter how much education you have. That number stays the same across the board. So then what is it? Because if I have an IQ of 175 and I got a perfect score on my SATs and I've earned every degree in the world and I make $500,000 a year and I still get pregnant and I go to have a baby and doctors still don't take good enough care of me that I don't die on the table, then what can I do? Because I got access, I got money, I got resources, and I'm still dying. Then
And
what's the
that's it.
problem?
Serena, if you remember, who was it? One of Serena, was it Serena that brought it to the forefront? And like you said, she got money coming from out of her ear and still did not get the treatment that she deserved.
Right, right. So what do we do? I don't know if y'all remember the Black female judge. She had a show. Her son's wife got pregnant. She died, and they ended up in a lawsuit against the hospital and the doctor. And you think about who this is, a prominent woman from a family with money and resources, high profile. And when they interviewed the husband, the judge's son, um, he said how he called. His wife was in pain and she was spiking fevers after she had the baby. And they paged the doctor all night and they were ignored. And basically what happened to his wife, she bled out. She hemorrhaged to death.
Mhm.
And that was preventable had somebody thought it important enough to listen to what he was saying to them. And even though I do what I do for a living,
That's
I still sometimes have to go into those spaces where it should be easy for me and I have to act a straight donkey to get the care I know I need or my daughter needs or even
Mhm.
my mom or well, whoever. And I think to myself, if I'm educated, if I know how to maneuver through this thing and it's this hard for me, can you imagine somebody who doesn't know going into those spaces and trying to be heard and not just not knowing?
Yeah, and not only that, Tawana, a lot of times when, I mean, and I learned this from mom and dad. If daddy went to the doctor, mama went with her.
Mm-hmm.
When I go to the doctor, I go, my husband go with me, or one of my daughters go with
Right.
me, or when my husband go, I go.
Mm-hmm.
Because there may be things you forget to say or things that you forget to mention, but it is important to have, even if the person doesn't have much of a education, it is really important to have someone there to advocate for you.
That is true. That is
A lot of
true.
the things that go lacking, and I this is I my last job, I just completely, I burned out,
Hmm.
um because the need was so great. And when my patients would come to see me, because a large part of the people I served were people struggling with homelessness, um and so when I saw them, that might be the first and the last time I ever got to see them. So if
Right.
they had 10 complaints, I was sitting there trying to address all 10 of those complaints and try to make them as whole as I could before they left. And the crazy thing was, I used to think to myself, and I remember this so well. I remember, I won't tell a lie because I don't really remember all the very specific details. But I remember having a patient come in, and I'm not quite sure. I don't remember what exactly he needed, but I know it was something I couldn't do, and he needed to be referred out to specialty. And I remember being so frustrated because he didn't have money, he didn't have insurance, but we had this program where we provided primary care, and sometimes we got lucky and we were able to reach out to other places and get the patients the help they needed. And I remember I was going round and around and around and around trying to get this guy out someplace. And I remember asking my medical director, I said, listen, you know, when a patient's got a problem and it's life or death, if we don't get them somewhere to see them, how do we explain it to them? When we, what do we say to them to tell them, you know what, there's nothing else I can do? And he just looked at me, black guy, shrugged his shoulder and said, yeah, you just tell them there's nothing else you can do. And to this day that still bothers me, because then it makes you wonder, well, why am I here?
Because you went into it to make a difference. And it's so funny that you told that story. Years ago, I went into the hospital with bowel luck. I had very minimal health insurance. So it wasn't really worth anything. And when I got in that emergency room, I was in that emergency room for 6 hours. They rushed to me once I started throwing up my own bile. They put that tube down, and I remember so clearly. I stayed in the hospital for 7 days. They took the tube. The doctor came in. He said, "Well, we think we got it cleared up with the tube, but we're going to have another doctor come in tomorrow and see you because you may need surgery." That doctor came in, never touched me, never did anything. She says, "You don't have enough insurance. Come back when it's done, when you get better insurance." They sent me home. I was home for a week, ended up back in the hospital again. They put another tube down. That was another 7 days. Sent me home. 2 days later, I went back to the hospital again. Kenny, this was during the time Todd died. I was in the hospital and Todd died in Florida. Then they come in, realize they could not clear this up with just a simple tube. Rush me to emergency surgery. So now you done built up 14 days of hospital bill on two different times. If the insurance wasn't no good then, it ain't no good now. But it's all about the money.
Hmm.
Part is, so and this is so funny this comes up because the other day, I don't remember what the news story was. I think it was a young boy needed a electronic wheelchair. It was
Mhm.
$20,000. The insurance company denied the claim, wouldn't pay for it. So a high school robotics team built him a wheelchair because the insurance
Yeah.
company wouldn't approve it. It made me think about, like, um, a patient's diabetic, right? And they don't
Mm-hmm.
have insurance to pay for insulin and medication, and they get a few dollars a month in food stamps, but fresh food and good food and whole grains is more expensive, so they buy lots of carbs and processed food and stuff, and so the diabetes never gets taken care of.
Right.
Because you can't get the insulin because it costs too much, and you got to choose between your light bill and paying for the insulin. The crazy thing is, once that diabetes gets bad enough and your kidneys shut down and you go blind and you need an amputation, you qualify for disability and Medicaid, and then it'll pay for everything.
Yeah. Instead of using preventive measures, they wait until it gets out of control,
Yeah.
probably hoping you would die so they don't have to be bothered
Right.
with it.
That's exactly right. And it's so backwards because it actually costs less for you to decrease the cost of insulin and make it affordable, or just give everybody Medicaid, expand Medicaid and the ACA and all of that stuff. That's much cheaper than paying for what it costs to take care of somebody who's diabetic, blind, and crippled and on dialysis for the next 25 or 30 years. It's like the logic is just so topsy turvy and turned on its head, and it just doesn't make sense. Because this is what I always tell people: like, you go to a regular doctor's appointment, they'll bill you get a bill
Mm-hmm.
for it. And I always tell people, I was like, you know what? It does not cost us that much. As an individual provider, it really costs nothing for a patient to walk in the office and have me see them and do an exam on them. Now, we're not talking about sending them off for fancy tests and x-rays and all that stuff, but just simply for a patient to walk in the room and for me to look in their ears and their eyes, down their throat, listen to their heart beat on their back a little bit, check the range. You just a simple exam, and to hear them tell me what they think is wrong, I might be able to fix something in the office, and it costs me pennies on the dollar to what people want us to think it costs. It costs
Mm-hmm.
more to run the electricity and the AC and pay the rent or the mortgage on the building and pay for all this. But for me as an individual provider, for a patient to come in and just see me, it really doesn't cost that much.
Yeah.
Mm-hmm.
But we deny access in a lot of ways.
Yeah.
And it's big business. The medical, all of it has turned into big business.
Yeah, that's what
You
it
go
is.
in for a physical, they do blood work. I remember back during the day they would call and tell you the results if nothing wasn't wrong. If something was wrong, they would tell you got to come back in the office. Well, now you go and have the physical, they do the blood work. They make another appointment for you to come back for them to tell you that there's nothing wrong.
That's so. Um, my patients know once you leave the office, for because a lot of them, when the HIV is under very good control, they don't have any other health issues. I only see them twice a year, and they
Mm-hmm.
don't come back. A lot of times I would tell them, listen, this is my direct extension. If you need something, then you call me and you leave me a message directly. And if we can figure it out without you having to come in, and I've done that. And one of the things I do like is that we're kind of making a move towards telemedicine, and doing
Mm-hmm.
like video visits and all of that stuff. So a lot of the things the patients need, we don't have to have them. Now, that doesn't mean they don't get billed for those visits, but it actually gives them flexibility so they don't have to make the choice of having to come and sit in the office for 2 hours, um, or get a bill bigger than what they need just because
Right.
they showed up in person, right? So there's lots of things that we can do, that maybe, like you said, big business is not interested in doing. You know,
Yeah.
um, it's just so many things, and we talking about like self-care. That's the other thing about, um
Mm-hmm.
how we get taken care of when we do. So, like, my patients come to see me and I can tell when they're not doing well after, I've known them for so long or whatever. And even when they're not taking care of themselves, a lot of the people of I've heard providers say, doctors, nurse practitioners, whoever, say, well, if they don't care, then I don't care. Well, that's
Wow.
not how that's supposed to work, right? That's not the thinking we supposed to be. That's not why we here. We supposed to educate and hopefully handhold and get them to care. You're gonna get those patients who you're not gonna be successful with. But there's more of them who, if you take the time, whether they care or understand or not, you continue to care and try to get them to understand so that they will start taking care of themselves. But if I throw my
Hmm.
hands up and they've already thrown their hands up, then and it is just kind of sad because very simple things like women knowing that they need to have a pap smear every so often, women knowing that they need to have a mammogram every so often, and being shamed by lots of things that are just part of being a woman, right? And so
Hmm.
that keeps them from even seeking out the care that they need sometimes because they feel like there's just judgment, and we got to get
Right.
away from that too.
Right.
Definitely.
Right. So, and all of that being said, what would be some of the suggestions that you would give to us as women as far as self care, along with all the things that you said, and even the mental part of it too? Because having all of these things on the plate, having to work, having to balance family, having to balance all these things. What suggestions would you give for them to take care of the mental?
That's a good question. Gosh,
We're all trying to figure it out.
I'm gonna speak from my point of view. We gotta let go some of the guilt we have. We gotta push off some of the judgment we get. So, like for me, I'm a single mom. I got a 13-year-old. I can say this now, but I'm telling you, I struggled with it so bad because I have to go to work. There's not another
Hmm.
breadwinner here in my household.
Hmm.
When the pandemic hit, I mean, work was just so crazy. It was everything. I ate, slept, breathe. Everything was work. You know, they went virtual. My daughter spent a lot of her time on her own as far as maneuvering through that, and I held on to a lot of guilt about that. But it was like, no, I gotta trudge through this. I have to work. I have to work. I have to work. You know, it was, and but I also at the same time felt guilty about not being able to be here with her all the time, um, to help her through what was going on. And it got to a point where I was starting to wear that burnout like it was a badge of honor. Like it was
Hmm.
almost like I was like, oh, I'm so tired. You know, it was like, I remember like my sister's a PA. I remember her posting something about like medical professionals getting up and going to work and said, everybody get up, we ride at dawn. Because like we out here, we soldiers out here fighting this pandemic. And it was so overwhelming and all that stuff. And like I said, a lot of us were wearing that stress and that burnout like a badge of honor when it really shouldn't be, right? And for
Hmm.
black women, like that image of the strong black woman, we it's cool to be strong. But man, sometimes it's also okay to be weak. And so we got to start letting go of some of that guilt. We got to ask for help. We got to say no. We got to recognize that we can work our fingers to the bone and kill ourselves doing it. But when we gone, ain't nobody here to take care of the things we were taking care of. So for me, I think a lot of this is going to come back to us. Number one, loving ourselves, but we also got to heal relationships between black men and black women too. And stop judging one another. Like, on the one hand, y'all want y'all grandmothers, but on the other hand, y'all want us to pay half of the bills. You know, my mom always says you can't ride two horses with one behind. We just got to figure out what we want to be to one another and how we want to maneuver through this. You know what I'm saying? And so I just think, I don't think it's just on us as Black women, and it's not just on Black men when it comes to self care of the Black community as a whole, too. I
Hmm.
think there's a lot of healing that needs to happen. Think we need to step away from the pettiness of how roles get defined in relationships and what that means. Like there's always arguments about, you know, if you move your girlfriend in with you, is she gonna pay half the bills? Does it matter? You do what's healthy for your relationship. Does it matter if the man of the house gets the first plate of food? Like these silly things, like even this argument about bonnets. There's so many other things to talk about, but we always seem to seize upon things that separate us. And when we separate ourselves, that's where these deficits happen. That's when each group has to take on more and more and more the farther away we get from each other. And this is what it becomes. So I
And
think it's big.
I agree with you on that, Tawana, especially, the part that you speak about relationships, because in a lot of people's lives, you know, they hold on to things that have passed and is done and over with. But when it comes down to these things in a relationship, it should not be, well, this is your role or that's your role. I feel like when you have two people together in a relationship, it's our role. And if we could get back to that point in the community, when we were growing up, we had the village. The village was there to help wherever there was a need. But now that the village is gone, it's like you said, the petty stuff. This is a whole nother conversation for another day. But when I look at it, when you look at our structure, when we were growing up, the old people was in the neighborhood, and if they saw you doing something down the street over there, or they saw you doing something over here, your parents knew before you got back home, and they done got a hold to you. Now your parents gonna get a hold to you, and it's this system that breaks our family structures down. You deal with from the prisons to the communities. The older people were the ones who kept the community going. And I'm not saying all old people are wise. You got to be careful who you take advice from, because not all of them are, straightforward and fair. But we had that. But then you think about it. They started building what we call these senior communities. They put the older people over there, the younger people over here with their children, and the guys in prison. So this is where our division and all of this stuff started. And it's just the stress of everything else now that seems like it just bears down on everybody. And nobody knows how to deal with it. Everybody's trying to figure it out.
Yeah.
Game. Like you got folks saying it's the single mama who's at fault for the breakdown of the Black family structure. You know,
The
it's
government,
gay people. It's it's so many things when really we come from Black people have all. People say Black people not monolithic. Okay, we not one big old thing, but the foundation of where we come from generally is the same, right? And so
the
we in a country that was founded on us being oppressed. And I don't,
separating the family.
yeah. And it was purposeful, right?
Mm-hmm.
Hmm.
It didn't happen by accident. It ain't like the Big Bang, like there's some big explosion happening and we just all ended where we are. These things were purposeful. And when if you had asked me about this stuff 10 years ago, I'd be like, oh, y'all don't know what y'all talking about. But just like just watching the way this stuff unfolds, it's so obvious how. Have y'all been following Kwame Brown at all?
I've seen him. Yeah.
Okay.
Yeah.
So, one of the things he said, without having to go into the background, one of the things he was talking about was how we in a space where it is difficult right now for any white person to just come out and blatantly say anything too extreme about black people, right? Without
Hmm.
risking being canceled or labeled a racist and all that stuff. So Kwame Brown said, so what they do is they get these black people and hire them as commentators and experts, and they put them out front and they let them say all the bad things they can't say about black people.
Mm-hmm.
And I never thought about it like that, right? And I was like, man,
I did.
he has got a
There's
point.
there's a lot of cops and black cops and sheriffs that do that, that are the spokesman for that type of
Yeah,
blatant disregard for black
yeah.
people. You know, I see it. I wanted to say something about what you were saying about the hospitals, and I
Mm-hmm.
mean everything you're saying is just like it's just it's got my matriculating over here. But the hospitals, how like Renee, you know, when we talk, you said they used to the doctor would just come to the house, and now they've just created a whole nother conglomerate, the medical profession or hospital, when the doctor wasn't even paid as much. It's like they're paying buildings fees, all kind of fees now that they're trying to recover for creating this conglomerate that there is a beast is really what it is. It's just a beast taken. It's never given anything because like what you were saying in the beginning, they really don't put value on in healthy black people. They make all their money off of unhealthy black people, you know, and black people being the ones who built America to this place it is, all that free labor they got, and still to continue to try to perpetuate it, man. It's like it's food for thought. It really is.
You know,
Yeah.
I
It's all big business.
Big
yeah,
business.
and I try not to wear. For obvious reasons, I try not to wear my heart on my sleeve, but it's difficult sometimes
Yeah.
because man, it's just it's hard, and like sometimes even just somebody posted that a video of a black nursemaid, and she was talking to a black patient, and she would talk and she would be like, pointing at her, how when we ask and trying to covertly be like, I'm talking about white people, and I was sitting there watching her, and even though it was funny, it is a portion of reality, right? Because when my patients come to see me, I like I said, I try not to wear my heart on my sleeve, but just the things I see, the difference in how I communicate with my patients compared to how another provider would or whatever. I don't want to be just completely familiar with them, because then that kind of erodes the patient provider relationship. But at the
Yeah.
same time, I want them to know that I get it. Just because I'm here and you there, that means nothing. Like, I hear you, I see you, and again, I honor and value what you are telling me about what your experience has been. Because sometimes I think, and I'm just speaking in general and about not about anything in particular. Educated people will dismiss what uneducated people say and think, because we just think we know better, and guess what, that's so short-sighted and untrue, it's not even funny. So like
That
if
is
a
very
patient
true.
patient
Let
tells you that they're dealing with something, just because you can't see it and feel it, and that's what people, just because you can't see it and feel it
feel it.
don't
It's
mean
not
it's
real.
not happening.
Right. I wanted to piggyback off of that right there. Renee, you know my favorite show, A Million Little Things.
Yeah.
Well, apparently, you know, they're going through what's going on in the world today. They're staying relevant with the time and with the police brutality and everything. And the black guy Rome, his wife got knocked over by a police when they were protesting, and now she's having memory loss and stuff, and her mom is white, so she's mixed, right? So she goes to the hospital to tell the doctor everything that's going on with her, and the doctor blows her off. And then her mother said had to step up and because she's white, she had the power. Said, my daughter told you this and this is wrong. And now you need to record this and put it down, and get her that MRI. I was just like, wow.
It happens. You remember the couple in Nilda that we had on for sickle cell.
Yeah. Mm-hmm.
Nilda tells a lot of stories like that. You
Wow.
know, our sickle cell patients, they go to the hospital when they're in crisis, and they're sitting here saying there is nothing wrong with you,
With
and
you.
they hold the medication back because
Yep.
it's in people who look like us.
Yep.
Percent yes. When I was a new nurse, oh, a lot of years ago, working Renee at a hospital at home, there were two patients, two young black patients that we considered frequent flyers at the hospital. And I worked the med surge floor, so we got a lot of different types of cases there. And
Hmm.
they were there all the time. Like it was once every month for one of them, once every 3 months they were admitted. And sickle cell crises are painful. They
Hmm.
are. They need to be there's a reason why you admit them to the hospital to manage them. And I remember just listening to the nurses talk about those patients being drug seekers. Oh, they
Uh-huh.
not in pain. They not this, they not that. And I'm just looking like, what do you mean? You know? And they would, want to withhold pain medicine and all of this stuff. Um,
Hmm.
there is actually research that says that when they surveyed young medical students and even some seasoned providers, their perception is that Black people have a much higher pain tolerance than anybody else. And so we are less likely to be prescribed medication that will adequately control our pain because there's a negative perception of Black people asking for pain relief, they're drug seekers, or that biologically Black people have a higher threshold for pain, meaning they don't need as much medicine or certain kinds of medicine to manage that
Hmm.
pain. And
Wow.
so, and like I said, these are not things that I'm just having patients tell me or I'm anecdotally like just seeing happen. This is
Hmm.
documented and researched
Hmm.
out of these medical students and these providers' mouths, their perception of Black people in pain compared to other people in pain.
In pain.
And
Wow.
so,
Like they can
to
feel it.
see that I've seen that happen where you hear the negative talk about the sickle cell patients in the hospital being drug seekers. They're
Hmm.
faking. They just want pain medicine.
Wow. Well, I want to take a time out right now and just welcome some of the viewers. I want to actually show this comment for you, Tawana. Okay,
Okay.
Felicia Seaman said something amazing. I think it's should be shared to you. So if you can see that, you're a trooper, and we appreciate you staying in the field because if we have no one there, we are already in a constant battle, and it would be unmanageable.
Thank you for that. And the thing is, we need more of us there. We need so many nurses, doctors, NPs, PAs. We need so many more of us there.
Mm,
So thank you for that.
awesome.
Yes.
Thank you, Felicia,
And
and
Tawana, if your sister is watching, let her know we're coming after her. We need more of these conversations.
oh yes. Yeah, we had a lot of viewers with comments tonight.
Were you saying something?
Were you saying something just now, Tuan?
No, I was just saying. I said, Renee, you talking about kosher?
Yes.
Yeah. So yeah, I don't know if she's watching or not, but I'll let her know.
Yeah, because we need more of these conversations.
Mhm.
Definitely. I mean, tonight you've given us so much food for thought, and the whole the whole beginning actually, with black women being the caretakers and how they took care of even breastfed babies that weren't even theirs. You know, when you think about how really ingrained this is, that caretaker, how ingrained it is in black women in that in the culture. And it's just you took me somewhere when you started talking about all that because I started thinking about all of that
And I
stuff,
wanted
man.
to tell her, be quiet, because I know him.
But that's the only way you understand where we are and how we get through
I
things now. Because
understand.
that's just the place, the space Black women occupy here in the world today. I mean, we just have always been expected to take care. And so we could go and talk about politics. Black women come to the rescue with the vote all the time. You know what I'm saying? But it's never really to our benefit or the benefit of the Black community. Our resources get used up for other people all the
The
time.
time.
So, you know,
Well, hats off to you, Tawana, and everybody like you, and to you, Grandma Polly, or should I say Renee?
And it's
But
like we tell everybody else, Tawana, our door is always open. You are always welcome to come back. Just hit us up and say, hey, I need a Thursday. We got you.
yes,
okay.
because you are a goddess.
Well,
You
thank you.
truly
I
a
appreciate
goddess.
y'all.
You are. You're healing the world, man. You're doing things to heal the world and make the world a better place. Um, and you're mentally healing people too because you're allowing them to express themselves and talk about the things that they're feeling. So that right there starts healing on a whole other level that will contribute to the physical ailments that they are experiencing as well. It's what I believe anyway.
Yeah.
'Cause I believe it all goes hand in hand. The mental, the physical, all of it works together.
Yeah. It's all
Hmm.
connected.
It's so important. Your compassion. Yes, another comment. Your compassion is so important. Hats off to
Yes,
you, Tawana. Hats off. Hold on, Tawana. Gotta give you some love. Gotta give you some love, man. Because what you do is
yes.
truly important.
But you gave us the great information. You put some. We know it, but I think you shed a bright light on it. It helped us to know, okay, what we're thinking and what we're seeing and what we're believing is just not in the mind. This is for real.
Hmm.
You shed a real big light on it. Awesome.
So, Tawana, can I ask you one question? Uh, like, what would you suggest? I know getting the word out is paramount, and these conversations and dialogues are paramount. But once is started and people start to feed into it, what would be the next step to gain more momentum to keep people educated and on top of anything they might be feeling or illness or anything?
Um, man, to be honest with you, I think access and visibility are the places that we're having a hard time going. So, like, I mean, there's so many things we didn't talk about today, and I know we out of time. But like for me, what I
You
see
coming back too.
are the access points for Black people where they can get to the education and the resources they need to be able to take care of themselves. And it has to start way before like they're 25 or 30 and trying to figure out how to maneuver. So like I mean, again, there's so much we didn't get a chance to talk to, but you got to start educating. We got to
The
start
kids.
educating our kids, right? So that they know. Again, going back to the thing about women and self care, we need to start having really frank talks about sex and sexuality with our young girls, with our boys too. But a lot, because I know Renee can attest to this. The only thing my mom told me about sex was don't do it.
Yeah,
You know
Keep
what
a
basically.
I'm
nickel
saying?
between keep a nickel between your knees.
Right.
You know,
You know,
that's
and
what
What?
I think where I see, because there's
I'll
really
tell
no
you about that,
excuse.
Kenny.
There's really no excuse for a 45-year-old woman with children to think that the baby grows inside her stomach. The children that she birthed came from her stomach. I'm so serious about, like, it's so profoundly, such a deep chasm in education. That's, I think, where we have to start. And it has to be really deliberate efforts, not just as an aside in health education class in eighth grade. And it shouldn't just happen in the schools. It should happen in the churches, and it should happen at home, and wherever else we can get the word out to begin. Because if you tell a child, just don't do it because I don't want you to, all that does is breed curiosity.
Mm-hmm.
But if you
It does.
talk to them about why I want you to wait, the responsibility of sex, the consequences of irresponsible sex, you're not trying to scare them. But then if they do make a decision, they can make one based off of knowledge and not just a feeling or curiosity, and know
You're
how to
right.
take care of themselves.
Right.
You're
So
right, Tawana.
I think education is where we need to start, but we need to just, like, you know how you put like hot sauce on fried chicken, we just need to cover the world with it, and let everybody, we need to stop, like I said, stop hiding behind the shame about who we are and who people have made us think we are, because the
But
only way is to start dialogue and get out here and put the work in and bring attention to it and find some resources to build places in our community where we can provide these things to people.
yes,
And
like
right, because we grew up with the taboo. These things were taboo you didn't talk
Hmm.
about. And
Hmm.
I can honestly say for myself, even when it came down to my children, I wasn't as open as it is out here now because you figure I teach the kids the way my parents taught me. And we need to get away from that.
We
But
have
my
to get
next
away from it.
question for you, Tuan, you want to come back next week and finish this conversation?
Cousin Renee, Grandma Polly, you know when you called me, what was the first thing I said to you? I said I'm shy. Much as I talk, I'm really a shy person and I don't really like to talk. But once you get me started, it's nonstop.
it's on. It's
It's
beautiful.
See,
so
you did
so
one
so
heck of a
so
job, but you need to finish this. You want to finish this next week?
so if you want me to come back, I yes, I'll come back for you.
All right. So look at somebody
Y'all tune
said.
in next. Look at it. Somebody says she definitely needs to come back.
Well, Stony, Felicia, Julia, Donna,
Yeah. Who's that?
Zerlene,
Stony Cat. No,
Myrtle.
that's Quana, right?
Yeah, I see Stony cutting. No, hey Stony.
Hey, Quana.
Oh
Yeah, I
Lord.
think this is a conversation that we need to carry on.
Yeah, this I mean, you could talk about it. It's just so many things, because as far as Black women go, economics, um, family dynamics, the self-care thing is just impacted by everything.
Yes.
Yes.
It it's just that hole. We could dig that hole and dig through the other side of the earth and still have some digging to do, because it's just
Mhm.
so many things. Um, Black women, we so neglected and maligned these days,
Mm-hmm.
and then we still will come to everybody's rescue. We'll still do that. We'll
Very
still do that.
true.
Well, I'm here to tell you, I got y'all back.
Well, thank you.
I
And
got
that's what
y'all
we
back.
need more of.
I
That's
got y'all
exactly what
back.
we need to have
Right
each
there.
other's back. Yep.
Yeah. Yeah, I know my wife. I look at some of the stuff that she does and that she faces in her job. She's one of the only black women in her field, and a
Hmm.
lot of the challenges that I'm ready to get in on somebody. You know.
We that direction next week, because I got, you know what I'm saying. I know y'all. Cause once I start talking, I just talk, and I'm really trying hard to filter myself. It's difficult, but just what you said just now. I deal with some of those things. I deal with the fact that I'm not a soft spoken person. Like, I make jokes about being shy, and I am shy to a certain extent, but if I got something to say, I'm going to say it. And I do get labeled as a heavy, the villain, the angry black woman in a lot of
That's
situations.
what she
I
hears a
do.
lot of.
Yeah.
Uh, and
And I'm not,
it's
I'm not angry. I'm just adamant.
you know, and there's another side, a whole other side that you just ignoring. Whole
Hmm.
other side, you know.
Yeah.
But I won't be ignoring it because I'm glad you're coming back next week.
Because
You know?
and this is what we're after, dealing with the real, talking about the real, and tongue tie. These are what my books are about. They deal with the real situations that's going
Hmm.
on in our community. And
Hmm.
that's why we started a conversation with Grandma Polly.
Yeah.
So people would get comfortable having these conversations.
And we
Mm-hmm.
should be comfortable having these we
Yep.
especially with each other, we should be really comfortable having these conversations. And that's why I talked
Mhm.
about letting go of shame and guilt, and just being okay with, because a lot of the things we feel about ourselves, we were taught by people
To
who are
feel
not us,
us, you
and we
know.
just carry them down, and we just gotta demolish that. We gotta begin to demolish all
The
that
same way
stuff.
that our culture was demolished, we need to demolish that
We
within us.
exactly.
Not trying to go out there killing or fighting and all that, but within ourselves, that inner
Within
battle,
ourselves. That's
we need to
right.
shift that
A lot of
consciousness. Yeah.
the side eyes we give each other
Yeah.
is because somebody else was giving the side eye, and we watched them do that,
Do
and
it.
we developed a disdain for any reflection of ourselves that other people don't approve of. That's
Yeah.
where a
And
lot of this comes from.
and
Oof.
that is
Preach,
so
girl.
funny that you say that, because that's one of the things I teach the kids when I'm with them. One will come up and say, "Oh, Grandma Polly, so and so said I'm this, or so and so said I'm that." And I try to catch them at an early age. It's like I tell them, what other people think of you is none of your business.
Hmm.
That's their problem. Don't allow them to inflict. Do you
Yeah.
know who you are? Let
Mm.
them, keep their opinions and thoughts to themselves, because not only the people out there, let's keep it real. It has happened from family members too.
Yeah.
Hmm.
They label certain family members, and it's just something that just keeps trickling down.
Yeah.
And we sometimes are our own worst enemy.
We absolutely are.
And we got to break
Hmm.
that cycle, man.
And we have to break that cycle.
Yeah. Yeah.
And conversations with Grandma Polly is a start.
That's funny. You know what? And we gonna close it out because Tawana coming back next week,
All
y'all.
right.
I'll be back next week.
Donna said, "Girl, you better preach. Awesome information." I'm just reading some of the text. Awesome information. Awesome conversation. Awesome job, Tawanna Lance. Tawanna Lance, you did good. Thank you, Kenneth. Your wife is fortunate to have you. I had to throw that in. Thank you, Felicia. I appreciate that. I'm sure she will too. Self care is a must. I preach this to my girls as well as my boys. Katina Green.
Mhm.
It's so many people chimed in tonight, Tawana. This conversation is really something that needed to happen, and we truly thank you for taking time out of your day, your evening, and spending it with us and sharing your expertise and knowledge with us. And we look forward to having you back next week. Truly
Back
do.
next week. Look
Next
what y'all
week.
done
I
started.
know.
Tawana, look, we gonna keep you on speed dial. You gonna be our Dr. Phil. You know
Oh,
what they want to call it?
Right? Right?
but listen, you got to put a disclaimer with any advice I give out here, because
Yeah.
my mind.
We will do
Oh
that.
my, put around in the family.
Oh boy. It is
Why
awesome.
they run in the family?
Yeah.
And
Yep.
Myrtle said, "Thank you, Grandma Polly, and others for providing conversation and the platform.
Yes.
Great
Thanks,
job,
thanks,
Tawana
thanks. And
Lance."
we want to continue it. And we want other people out there,
Yeah,
Right.
hey, you got a topic you want us to talk about? You got a topic that you want to be on?
the show. And you can call in as well. I was going back and forth with it tonight, but our number is 478 202 4271. You could actually talk to Tawanna. You know what I'm saying? Next week, call her
What
and ask her
they
what you want to
call
ask her.
in next week? Huh?
I said, call her next
Dear
week and
Kenny.
ask her whatever you want to ask her.
Yeah.
Yeah.
The number will be up next week too, guys. So thank you all for chiming in tonight with all your comments and your heart and your love. It's greatly appreciated. And Tawanna, I can't thank you enough for all the information, the wisdom, the love, the joy, the compassion that you have to get this out to people. You know, it's it takes my breath away.
Take more people like
That's
her. It's
right.
going to take more people like her.
Yeah, it
And it
is.
I
takes her
don't.
educating us so that we can talk. When we talk to other people, we know what we're talking about.
Talking about. Yeah,
Yeah.
definitely. Definitely. Well, Grandma Polly, any
Yep,
final
we
words?
good. I just want to thank everybody for checking in this evening. And Tawanna, our new Dr. Phil. Yep.
No, Dr. Phil is the new Tawanna, okay?
Yes. Okay. Over here, Dr. Phil, we got Tawanna.
Exactly. Exactly.
Yep. Thanks
So,
everybody for watching. And we'll see y'all next Thursday at 7 o'clock.
all right,
Thank you,
guys. Just want
Tawanna.
to put up a little flyer to show everybody
Yeah.
the time and date. Um,
And don't leave yet, Tawanna.
Okay.
It's not coming up. But on another note, we're gonna go ahead and end it. But you can catch conversations with Grandma Polly every Thursday night at 7 p.m., where you'll get the knowledge and the wisdom and the expertise from people who are actually doing and living the life that they are providing the wisdom for us to live by.
Making
So,
a difference.
making a difference. So, with that said, everybody, we love you. We're signing off.
And good night.
And good night, everybody. Okay.
We are.
Anytime now.
Here come the big rig kids, roll with the big rig kids. Let's have fire the truck, take you to such amazing places with the big rig kids. Those helpful big rig kids, see how they give and grow and get to know amazing things. Learn with the big rig kids, and you'll see how it is to have adventure days and hang and play with all your friends. Because the big rig kids know what it is to live a most exciting and inviting life is positive. Sapphire with the voice of wisdom keeps the story rolling, and by golly, Grandma Polly drives them all to where they're going. Hop on in, everybody. Let's go. Caden, he's the leader of the crew. He's smart and brave and true. Sasha, Caden's twin, she cares a lot but can be stubborn too. Caden loves a good book too. And then Sasha, she's a regular computer guru. These are the big rig kids. Roll with the big rig kids. Let's have fire the truck, take you to such amazing places with the big rig kids. Those helpful big rig kids. See how they give and grow and get to know amazing things. Now Maria can be rude and bossy, braces on her legs and knees, but it's not fun and hard to run with a disability.